back with leading dentist and oral health expert, Dr. Jonathan Levine, and we're about to show you 2 groundbreaking oral cancer screening tests that you need to know about. Terry's here to help. She's volunteered her mouth very bravely. Thank you.
You're welcome.
You go to the dentist often?
I do.
Does it strike fear into your heart when you do see the dentist?
It depends on what they're doing.
It does, doesn't it?
It sure does.
Have you ever had a dentist, in your opinion, examine your mouth for cancer?
No, because you only get 15 minutes there.
All right.
When you make your appointment, you have a 15-minute appointment. So I would say no.
So I want to change that across America today. So the first oral cancer screening test is something we're going to talk about called the Velscope. But before you show me the Velscope, can you just show us what an exam looks like fundamentally?
Okay. So a normal examination, we really want to look at all of the soft tissues in the mouth. So I'm going to put my loops on. Please put your head back a little bit. Open for me. Open me. And what we're looking at the lips. We're looking at the oral and buccal mucosa. Open real big. We're looking at the cheeks. We're looking at the oral pharyngeal area, the tonsil area, all the way in the back, right? And now stick out your tongue, and the traditional ways we use this gauze as a tongue lasso. We go right around the tongue, and we're able to see the sides of the tongue, underneath the tongue, towards the floor of the mouth, left, right, and we'll say ah, and we're looking for any unusual red or white spots, any dark spots in the mouth.
Now, that lasso you saw Dr. Levine put in, that's your telltale sign that someone's examining you. They don't need any newfangled technology. It's not expensive. It just takes a minute. You just saw the exam. So even if you've got 15 minutes, if you get the 1 extra minute, the 16th minute, it could save your life.
Absolutely.
Okay, talk to me about the Velscope. We've got 2 technologies that are changing dramatically how we can quickly screen and identify cancers. This thing is really cool.
So the Velscope is a new technology, and it's a visualization tool, and it allows us to see the normal tissue and compare it if there's any abnormal cells. And it will highlight these abnormal cells early when it's dysplastic changes. What that means is when the cells are just changing from healthy to unhealthy.
You just have to glasses.
Let's get your glasses on. Oh, yeah, we're going to protect those baby
like
blue eyes.
Elton John.
Okay.
Yes.
There you go.
Yes, she does.
All right. Come put your head back for me. Open for me. And we're going to look through. It's a narrow blue light.
I'm just going to put this on there so everyone can see as well.
A narrow blue light with special filters. And you see the green, the kind of apple green color. That means health. But when the cells start changing a little bit.
And let me show you an example of what happens when they do change. Here's the picture that we would have gotten normally. This is a normal eye view. It's just, tooth is here, and, you don't see anything too abnormal here. But notice this area looks a little bit indented. Look what happens in the Velscope. Instead of the normal green, you have that darkened area. So you all see that? Yeah. So it's very helpful to aid the eye in identifying that as not being normal.
Exactly. And when you see that dark area, when the clinician or the hygienist sees that dark area, now we know that we have some tissue that are dysplastic or even precancerous or even worse, and we know we have to take action.
Now, if there is abnormal tissue, there's a second groundbreaking test. And I love this again because I hate the idea of a doctor having to take a knife and scrape stuff that's not really bad in your mouth. And so this is a brush technique. If you don't mind explaining, it's called the oral CDX brush test. If you could demonstrate it, I think everyone should have this also. The back of your mind is a quick way of making sure you don't have anything going on.